So thank you very much. Thank you for having me. And I would like to start my presentation, which is navigating excellence in infection control education and training, and looking into adapting artificial intelligence technology for safer healthcare practices. It's very important to understand that we are in a healthcare that keeps on evolving, and nursing education has to evolve as well. We look for transformation, we look for new methods of providing education, and today we are going to explore what can artificial intelligence provide us as nursing education in terms of training the generations with infection control. Now, the topic that we've selected today in infection control, it might seem to be a little bit basic, and people might be thinking, why are we looking into something like PPEs or hand hygiene? But I would like to stress that for us, this is the basic of any practice in nursing, and this is how we prevent any kind of transmission of any disease condition. So in this presentation, we would like to look into how can we, in nursing education, transform the way that we provide education to our professionals. Let me see if you're able to see. Is my screen moving? Okay, let me have a look. So hopefully by the end of this presentation, we will be able to look into what is the intersection between nursing education, artificial intelligence, and what really matters for educators. We're also going to look into the different opportunities that we believe artificial intelligence can provide. And at the same time, we're going to look into what challenges or expectations do we have from artificial intelligence. And we will also discuss nursing educators' need for the artificial intelligence. So before we start, let's ask those questions. I always like asking myself, what matters for nurse education and for nurse educators? The first thing is, in general, and not just infection control, we always try to balance the providing theoretical knowledge, and the practice and the application of this knowledge into the clinical area. So educators, you will find them that they will try to find different ways of immersing and having the learners have hands-on experience so that they master the skill that they would like to be at that level. So this is something that we were wondering, would artificial intelligence be of any support? The second thing is, we have varying levels of nurses and learners, and we have nurse graduates, we have seasoned, experienced nurses. So the question comes, how can we tailor educational programs so that they look into all those variety, and they look into different cultural backgrounds, educational backgrounds of our nurses and learners? We also sometimes have issue with time, and infection control, the basic practices of infection control comes with each competency training that we provide. This is how we start. But sometimes we wonder, are we really giving it the time that it needs so that we master before we go to the next competency, for example, or the remaining of the skills that we want them to learn? Evaluating training effectiveness. Now here I need to stress on the fact that educators are data-driven as well as result-oriented. So what does that mean? For nurse educators, before we try to start any kind of education, we always ask ourselves, what is the data? What is the data telling us? What literature is telling us? Is there any new protocol? Is there any new guidelines? What is expected from us? Is there any new regulatory guidelines that we need to look into? How are we doing as an organization? How does the infection rate looks in our hospital, for example? And at the same time, we are result-oriented. So now that we provided education and training, we would like to measure the effectiveness of this training. And we do not want people just to be happy with the training that they are receiving. We would like to see change in the behavior. We would like to see them practice what they have learned and to master the skills. And definitely infection control is what we aim, having all of our nurses being an expert. So this is what really matters for a nurse educator. We go to the next. Okay. So that is why for us, having competency-based education, which is a new method of education in which we look into going beyond just the time that we provide education, or going beyond the credit points that people might earn. Here we are focused on outcomes. We would like to see our learners demonstrate mastery of the skills, and we would like them to have personalized learning pathways, which means in nursing education, we understand that people have different pace of learning something new. learning varies from one person to the other, and we embrace this change and this diverse in the learners that we have. And that's why we're looking into the possibility of having artificial intelligence supporting us with the competency-based education, which is more of outcome-oriented. So we don't want to emphasize on the time that a skill mastering would take. Rather, we would like to see when would you reach where you need to reach. And we need to be very clear with our learners and nurses, what is the level of competency that we want them to reach into. We would also like to navigate the opportunity of using deliberate practice. And if you look into this, deliberate practice is an excellent way in adult learning where you focus on one topic, on one competency, on one part of the skill even, where you want people to start looking into how am I performing? What is my weakness area? And then they keep on doing deliberate practice, which means they keep on practicing. But the difference in this practice is that it's a purposeful practice, it's a conscious practice, it's a goal-oriented practice that would be helping them achieve the level that they want. And in deliberate practice, what we look for is having a purposeful feedback. So whenever I do a skill, I would like my educator to tell me exactly what did I do well, what are the areas of improvement, and I would like to be a person who is consciously thinking about my practice with the aim of improving. So it's not just practicing, it's not the number of times, it's the quality of the practice that we want. And we want our learners to be engaged in the learning and to have that kind of connection and ownership of their own learning. So we are also wondering, would artificial intelligence help us in reaching to an excellent competency-based education, excellent deliberate practice? So if you look into this in a graph, for example, you would see that in any organization, what we aim for is increasing the performance of our nurses, increase the performance of all healthcare professionals in general. And this would be achieved if we are able to increase the amount that they have deliberate practice. So here comes the question, would artificial intelligence again provide us with the time that we were a little bit worried about in terms of having constrained time and not being able to allow people to have all the deliberate practice and keep on exercising? And you would see in this graph that the learners will reach into a level where they become more effortless towards their own learning until they go to the maximal performance. And this is where we would like them to be. If you look into this graph, this is something that we are all aware of. This is the novice to expert model, which is Patricia Benner's model. And you can see that when you start in any scale, you're a novice, then you keep on progressing into an advanced beginner, competent, proficient, expert. And what I like in this graph is that it talks to us about automatic expert. So this is when you become much higher than an expert. And this is a situation where you would be doing the things and a skill without even thinking about it. So I would say this is a situation where you can be acting as an autopilot mode. You know exactly what you need to do. You don't think you would be doing all your, if we look into an infection control and the donning, doffing, you will be going through all the steps without thinking and without having any mistakes. And at the same time, you can see that we have deliberate experts, and those are the people who would push themselves beyond that level, understanding that there are always change and there's always something new to learn. And this is what we would like to see in the education that we are providing. Also extremely important is we would like, as nurse educators, to foster our learners' psychological safety. A lot of people, when they are being tested, when they are being monitored, when they go through competency, they tend to be uncomfortable. And we would like to offer them a kind of a safe, let's say, practice, a safe environment practice. And this is what we would like AI to support us with, ensuring that they are in a situation or in an environment which is blame-free, risk-free, where people can keep on repeating until they reach the level which is expected from them and that they are happy with their performance. Okay, so now here comes the question. What is something that we are worried about in terms of artificial intelligence and using it in nursing education? And those are the two main components that I thought I would like to discuss them today. So addressing privacy, we would like to ensure that our learners' information should always be kept private, and we would like it to be confidential. We would like people to be able to practice without the fear of knowing that someone somewhere is collecting data and this might be used against me. Because with education, we would like people to be expert in their field. We want them to be comfortable, calm whenever they go through any kind of education. And also extremely, extremely important for us as nurse education is keeping the human interaction. We don't want nurses to be robots. That's not what we want them to be. That's not what nursing is. We want them to be compassionate practitioners. We want them to be critical thinkers. We want them to be kind, to humanize the whole experience of a patient. And we would like to see artificial intelligence as a complement and helping us in supporting the education and the training of our nurses. But we do not want this to take over the human touch that is the uniqueness of our nurses. So those are two things that we would like to think, would artificial intelligence be able to help us? And finally, I would say, what do educators need from artificial intelligence? We wanted to help us in providing or creating personalized learning paths. We embrace the diversity and difference among people, and we want people to learn. Learning happens at different intervals from one person to the other. We would also like the artificial intelligence to be able to provide us with immediate, accurate, and real-time feedback. We are not there all the time to support our learners and nurses at the bedside. We would like to have technology that will be telling us the impact of our education and training on them and its impact on the real life. And also, we would like the artificial intelligence to help us develop assessment, evaluation tools. We would like to be faster than the way we are. We would like to be able to do a lot in the short time that we might be having in any education. And also, we would like artificial intelligence to tell us what is the most suitable learning resource for this learner based on the assessment, the accurate assessment that the artificial intelligence have done. We also want artificial intelligence to help and maintain the psychological safety of our learners and definitely providing equity assurance and bias mitigation. We want to make sure that whenever we assess somebody, it's the same type of assessment, the same tool, and the same support that everyone is receiving. So this is what we would like to see in artificial intelligence, and those are my references. Thank you very much.